On November 12, 2024, CBC reported that a 21-year-old woman, Joy Spence, visited the ER 10 times in 12 days. Despite her mentioning severe abdominal pain, she was dismissed repeatedly with claims her symptoms were either psychological or minor. It wasn't until her appendix turned gangrenous that doctors finally took action. But by then, the damage was already done, and Joy had lost a year of school, her job, and her confidence in the healthcare system. Unfortunately, Joy's story is not unique. Hi, we are
Jack Janice.
Erin Madugtog.
Dylan Sharma.
Caitlin G.
Bryce Arthur Moore.
Grant Sadarozny.
and Tafsin Tanha Mahmood, and for this year's IBM Service Design Challenge, we want to talk about the persisting critical issue in healthcare, the gaslighting and misdiagnosis of women in Canada. In Canada, almost 70% patients with medically unexplained symptoms are women. And even in cases where they get a diagnosis, they often get brushed off as psychosomatic, especially in regard to gynecological conditions. This bias doesn't just delay treatment, it can cost lives. For decades, medical research has centered around men, with clinical trials often excluding women and creating diagnostic frameworks that overlook their critical biological and hormonal differences. This bias has led to the dismissal of women's chronic pain as hormonal or hysterical, perpetuating a one-size-fits-all approach to diagnosis and leaving many women feeling disempowered to challenge their doctors. Adding to this systematic issue, it is also observed that the quality of Canadian healthcare is declining due to funding mismanagement. Physicians face chronic time constraints, which results in burnout, rushed interactions, and lower quality of care, further adding to the neglect of individualized care for women. Our research aims to tackle this issue head-on. We want to explore questions like, how does age influence the likelihood of women experiencing gaslighting and misdiagnosis in healthcare, and how do these experiences vary across different life stages? How do women's experiences with gaslighting and misdiagnosis impact their trust in healthcare providers and their willingness to seek future medical care? What type of support do women need after these experiences? And how can healthcare institutions improve awareness and training to help providers recognize and prevent gender bias? To answer these questions, we plan on talking to young Canadian women aged 18 to 25 years old, focusing on their challenges and needs in early adulthood. And to contrast this, we will collect insights from older Canadian women aged 51 and above on their experiences and advice. Our goal is to understand the scope of this issue by listening to women's experiences and advocate for a systematic change, and provide resources to support women who've been dismissed and misdiagnosed. This research isn't just about identifying problems, it's about driving change, because no one should feel minimized or unheard in a doctor's office. Together, we can build a healthcare system that listens, learns, and heals equally and equitably.